be super careful about what kind of birth control you get. They all kind of suck, but I think personally IUDs suck the most. Because when something goes wrong, it goes really, 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 really wrong.
It's been 6 weeks since I got my IUD removed, or as I like to call it, my IUD-FH, intrauterine device from hell.
One morning I woke up just bleeding, woke up, and the whole thing was just a mess, and I said I gotta go to the hospital.
It's stuck. It is stuck in my... And I was supposed to get surgery for it to get it removed, because now we've moved past them trying to remove it.
Hello everybody, welcome back to my channel. It's Cynthia here, and guys, in today's video we're going to be talking about shocking IUD horror stories. Before I proceed into this video, I would like to warn you, this has a lot of TMI, so if you know you're going to be comfortable with this type of information, then please keep on watching. The purpose of doing this video is just to look at other people's experiences with the IUD. But before we get right into the video proper, I would like to make some terms really clear to us, so as the video progresses, we are up to speed. First things first, IUD is an intrauterine device. This is a form of birth control where a healthcare provider inserts it into your uterus. Now, basically, once it's inserted, an IUD can prevent pregnancy for up to 10 years. Yes, or more, depending on the specific type you used. Now, the good part about this is your provider can remove it whenever you decide to get pregnant, or whenever you just decide to remove it from your body for reasons best known to you. So what are the basic side effects of IUD? This includes irregular bleeding for several months. This bleeding may be light or heavy, or even as a form of short period. Sometimes you don't even get to see your period at all for months. Another side effect can be symptoms of premenstrual syndrome, such as nausea, vomiting, tenderness of the skin blemishes, headaches. A common side effect of IUD is our good old enemy, weight gain. Yes, most women tend to add a lot of weight while on this form of birth control. Moving over to the frequently asked question, can you still get pregnant when you're on IUD? The big answer is yes, you can. But this happens in less than 1% of women that have IUDs in them. So it's very unlikely. Now, the final thing I'm going to make clear to us is this term OBGYN. You're going to be hearing this frequently in the video, and I just want us to know what it is. So OBGYN is basically obstetric and gynecology. Now, this is a specialist that encompasses the two specialties, which is obstetric, covering childbirth, pregnancy, and postpartum periods, and gynecology, covering the health of the female's reproductive system in general. Now that this is out of the way, let's get right into these stories.
Hey y'all, I have another IUD update for you all. Today I met with my OBGYN and she showed me my x-ray and confirmed that my IUD is no longer in my cervix and uterus area. It has shifted to
This is so scary.
The right pelvic abdominal area, and that's where it's currently located. She did tell me that I will have to have surgery and be put under for it to be removed. She said the surgery should take about an hour unless she has some difficulty or struggle with getting the IUD out because where it's sitting, and hopefully by the time I have the surgery it hasn't shifted anymore. But if that's the case, she said they would have a backup surgeon right there ready to assist and help out if need be. She also told me the recovery after the surgery is 2 months. She said I cannot work out, I can't do no heavy lifting, I can only walk. But I'll keep you guys updated. That's all the info I have for right now.
This is so scary. You're getting this done with a good cause, and at the end of the day you're having complications to the point where surgery has to be done. This is really scary, I must say. Let's get right into the next update, where she was telling us how she found out something was wrong and made her to go check it out.
To where I had to take deep breaths to get through the cramps or sit down or lay down, and I had something that appeared to be like a heavy period for the whole month of December. And at that point in time, I had only been on the Mirena for about 3 months. And because of my discomfort and everything that was going on, that is what prompted me to go in to see an OBGYN. So the OBGYN who initially inserted it was unavailable, so I got scheduled with someone else. And when I went in, I was telling her what was going on, and I said I want it removed. I want to get on another birth control. And she's like, okay, no problem. Like, I completely understand. And so when she went to remove it, she could not feel the strings. She looked for 30 minutes and could not locate them. And that is why she scheduled me to do a vaginal ultrasound and an x-ray. The ultrasound, they couldn't see it, but that's because if you see on my x-ray picture, it's shifted all the way up to my pelvis and abdomen area. So that's why they weren't able to locate on the ultrasound. Now, I'm not sure if my discomfort was caused because it moved or because it was put in wrong or what. But when I asked my doctor that question yesterday, she said it's very possible that at the time that that's why I was having the discomfort and the cramping and bleeding. And another thing that's alarming is that the OBGYN who originally put it in, she did not schedule me for my 2 to 4 week follow-up. So anytime you get an IUD, you're supposed to have a follow-up. And at that point in time, the doctor would check to see if they can feel your strings, if it didn't, your body didn't reject it, and if it's placed correctly. That OBGYN didn't do that.
Oh my God, this is so frustrating. Like everything about the whole thing is just making my blood to boil. Oh my God. Women, we definitely need our flowers. A lot of things just go on in our body. We definitely go through a lot.
What the fuck? Did doctors get the idea that IUD insertion only feels like just...
Literally could not agree more. So I went in to get mine because I had found out that I had endometriosis, and I was told that that was going to help lessen the pain of when I had my time of the month. I'm thinking that's great because it literally feels like somebody is taking a sharp object, shoving it inside of me and going blinding pain. So I'm laying there, got my feet up in the stirrups, I'm spready ready. Doctor comes in and says, oh, you're gonna feel a little pinch. A little pinch? A little pinch? If I deck you in the face, is it gonna feel like a little punch? That shit hurt. But I'm gritting and bearing it because I'm like, you know, end goals. Then they say, you're gonna feel a little pressure. A little fucking pressure? That wasn't pressure. That was straight up agony. It was worse than any period pain I had felt. I was like, I would rather have the period pain at this point if this is what I have to go through. They're like, oh no, this is gonna be great. It's gonna be so good for you. Are you okay? Sweat pouring off of my face. I'm like, I guess. Flash by about a month. The only worst pain I ever felt after that was when it was rejected. I really couldn't function. It was so bad. And I was a broke bitch. So I got a cab to go to the hospital where they're like, oh, are you feeling some slight discomfort? I swear to God, if somebody ever compares that to a slight discomfort, kick them in their genitalia. Very hard. Oh, is that slightly uncomfortable? It was horrifying.
Oh my God.
And I have never gotten one since. Nope, I'm good. Still have endo. And I have PCOS, so that's even funner. So essentially my insides are like a war zone. Yeah, it's an inhospitable environment. But I've just learned to push past the pain. You get up, you go to work. It's just another day. Maybe that's why my pain tolerance is very high.
Oh my God, women definitely go through a lot. Like, I have never gotten IUD before, so I don't know these feelings these ladies are talking about. But for those of you that have gotten your IUDs, let me know in the comments how it worked out for you. Was it a good experience you had? Was it a bad experience you had? Let me just know, because it looks like this is very unsafe, even though a lot of people swear by it. But yes, let's go right into the next story.
It's my third one, and it was the worst experience of my fucking life.
Okay, I want to talk about what she's talking about because this also happened to me. If you have an IUD and the strings migrate into your uterus, which can happen naturally, the doctors will have to dilate your cervix in order to get the IUD out. This is very painful. And then on top of it, they're going to put her on a month of birth control pill in order to mitigate the bleeding that they caused from removing the IUD. I talk extensively about natural birth control methods on my page, and I want you to know that if this sounds awful to you, this experience with the IUD, that you don't have to go through that. Look, I get it. You want an IUD. I got an IUD because they tell you it's 98% effective at preventing pregnancy. But did they also tell you that the fertility awareness method, when done perfectly, is 98% effective at preventing pregnancy?
So that's it. Just another thing a lady has to go through just to prevent getting pregnant.
Okay, I hear a lot of IUD stories, and I would love to share mine too. IUD, intrauterine device, just in case anyone's wondering. So I had an IUD placed when I was 17. I'm 32 now, so many years ago.
Oh, that's long.
I started getting an irregular period when I was 12, so they started me on birth control when I was 12. So by 17, I was like, birth control kind of sucks. Can I try something else? And they were like, Marina, let's do this. I remember going to the appointment and I was thinking like, this is no big deal. I'm going to be totally fine. I laid down before the procedure and there's a nurse comes to my side and my doctor's like, you're going to want to hold her hand. And I was like, no, I'm really good with pain. I'm going to be totally fine. And the doctor's like, you're going to want to hold her hand. So I was like, fine, okay. So I held her hand. Holy shit. As soon as that thing shoved into my cervix, whoa, mother of pearl. I was like, you gotta get it out, you gotta get it out, you gotta get that out. Horribly painful. They really do not prepare you for the amount of pain it is. It was awful. And the pain doesn't end after, and like, it's not just during insertion that hurts. I had contractions for 9 hours after the placement. What? My dad drove me to that appointment and had to drive me home having contractions to an IUD. It is not something I will ever try again. I didn't have a period for 6 months, but then I had a period every day for 9 months until I had it taken out because I had so many issues where I felt like the placement was moving, it was uncomfortable. Yeah, not for me.
I'm sorry. She had a period every day for 9 freaking months? What? This is extreme. Oh my god. Like I'm literally scared on their behalf because this is really traumatizing. This is so traumatic. There's nothing nobody will tell me.
I saw some girl on TikTok share her crazy IUD story, so that was my sign to share mine. By the way, this is also super, super rare, so if you're thinking about getting an IUD, don't let this scare you. This is super, super rare. For context, I got my IUD inserted about, over a year ago, so 2021, September. I started feeling this, insane pain at the end of October, 2022. It was right after I went to go visit my boyfriend for about a week. Once I got back after visiting him, I was experiencing, the worst cramps ever. I was getting a period cramp times 10, the worst period cramp I have ever gotten in my life. Worse than when the IUD got inserted. It literally felt like I was being sucker punched a trillion times from the inside out. It was so, so bad. Basically, I was trying to call my doctor, my gynecologist, to get an appointment, but it was really difficult to actually get an appointment, so it ended up taking a few weeks longer than anticipated. And when I finally got to go see my doctor, before my gynecologist, my doctor was so confused with what she saw inside me. So basically, she opened everything up to check out what was going on, and her face was like, what? What is going on? She was like, in my 17 years of practice, I've never seen this before. I don't even know how to explain it. Then I go see my gynecologist about a week later, and she's says the exact same thing. She's like, what is this? I'm a gynecologist and I've never seen this. And also it took me a month to get the appointment. So they did not deem whatever was going on with me serious. So they actually had no idea what was going on. But basically, when you get an IUD, there are 2 strings that come out of the actual device. So you're able to pull it out at the end of the 5 years or whenever you want to get rid of it. It's an easy yank system. Okay, not yank, but Basically, one of those strings that is attached to the IUD was poking inside of my cervix. It's poking inside my cervix, then poking back out, sort of like a needle, sewing, or an ingrown hair, I guess you could say. Basically, the string was has carved in and then carved back out. No idea how that could have happened, but that's what was causing the really bad cramps and why it felt like it was being inserted. It's because my cervix was being impended. My gynecologist was literally, what the fuck? We're gonna reevaluate this and figure out what we could do. My gyno was also super nice about it. She wasn't scaring me. She was like, you're actually it's totally fine. It doesn't seem like there's anything urgent or bad. But she was so caught off guard by the situation. She literally was like, I would love to write an article about this. Like, I want to take a picture and literally show you what's going on. It's that insane. Basically, I'm getting it taken out and reinserted today, so we'll see how it goes.
Did she just say she's getting it reinserted again? Do people not just learn from their mistakes? Like, I'll be the last person to want to get that thing reinserted after this horrific experience. Like,
so last year I went to get my IUD removed, so let's talk about it. One morning
talk
I woke
about
up
it.
just bleeding, woke up, bed, whole,
It's the
like, whole thing
bleeding
was just
for
a mess.
me.
And I said, I gotta go to the hospital. What is going on with me? And I went to the hospital. They're like, maybe you gotta get your IUD removed. Maybe it's not agreeing with your body. Just go back to where you got it done and just remove it. So I said, okay, cool, bet, let's do it. Got it removed that same week. The next day, right, so they actually said you're gonna be fine, everything's gonna go back to normal, like your body will adjust, here's some birth control pills if you need birth control, but like you'll be good. And then the next day, I started hemorrhaging blood as if I were giving birth to a demon.
What?
That's right, a demon. Girl, I don't even know what to tell you. It was the scariest time of my life, and I like, till this day I'm traumatized by it. It's been like 6 months.
You have
I'm still
to.
traumatized by it. And no one tells you that one of the potential side effects of removing your IUD is that you can start hemorrhaging, and that's not normal. So the amount of blood I lost, it was so concerning, and I had called back the hospital the next day saying, hey, is this like a normal reaction? Should I be going back to emergency? What is going on? It was a male doctor that had called me back, and he said, yes, this happens to a small percentage of women. You'll be fine. But you know the audacity? You know what he asked me afterwards? He said, so what are you going to do for birth control now? And I was
What?
like,
Who's thinking about that?
because I am hemorrhaging blood. He literally laughed. He laughed.
Oh my God. How
Said,
insensitive.
Oh, that's good. Well, if you need birth control, just call us and we'll help you get something else. Sir, who is thinking about at this time?
Like, for real.
At this time. I need help. That is the last thing on my mind. I never forgot that, man. I never forgot that day. It was so horrifying, so humiliating. And like, my experience with the healthcare system continues to be the same. Men dismissing our problems, the hemorrhaging blood, the audacity that I've received, it just doesn't make sense, and it's really astonishing. Anyhow, if you're gonna get your IUD removed, please have a backup plan, because if you're hemorrhaging, go to the ER. Go and get some help, but just know that that's not normal.
Really, it's the audacity for me. Like, I'm literally hemorrhaging, and you're asking me, so what are we going to do for birth control? Who is thinking about that right now? The lady just wanted to be fine. At that point, you should have concentrated on getting her feel better. I don't want to make this about men or women, but sometimes you just see reasons why, women feel the way they feel about the other gender, because why is that the next thing that comes out of your mouth? Anyway, bleeding, and it's not time for you to bleed, is alarming. It's serious, it's risky. You need to check yourself. You need to get all the help you can get, because it's not normal. That's something I'm going to see for sure.
You want to know what it's like being a woman in America? I'll tell you right now. I have been on my IUD birth control for about 4 years now, meaning next year is when I'm supposed to take it out. 2 years into having this birth control, I stated some of my concerns to my practitioner and explained that I was having mood swings, that I was having really bad acne, that I was having weight gain. Let's keep in mind, I started my birth control 4 years ago. Within those 4 years, okay, I've gained almost 100 pounds. Actually, it might even be more than that. A little over 100 pounds, okay? Not only was the weight a problem, I got all the side effects, all the fucking side effects that you could think of. And there's a list of side effects. And I had been complaining to my practitioner from the time I got onto it up until this very day about this birth control. Finally, this year in January, I noticed some bleeding. I noticed some pretty heavy bleeding. And despite all of my efforts to take out this birth control, my doctors gave me the runaround up until January. January comes, I go to my doctor, I'm like, hey, I'm in a lot of pain. Hey, I'm bleeding, I'm having a lot of bleeding, more than usual, right? More pain than usual, more bleeding than usual.
Oh my God.
They did nothing. They were, oh, you're fine, like, don't worry about it. Like, it happens with this type of birth control. They did not care. February comes around and I'm adamant about this bleeding. I went to the ER. The ER told me they couldn't do anything. I had to go see my OB. So I go to my OB. 2 weeks later, I'm still bleeding. And finally, my OB tells me, oh, seems like it's shifted, like it's moved. Really?
Seems like.
Could have told you that 2 months ago. I noticed that it was hurting more and I was bleeding. Obviously, something happened. February, she notices that it's dislocated. They try to take it out, right? They can't take it out. They scheduled me to go to a separate office and have them do it under ultrasound to see if they can get it out. They try to get it out. Can't take it out. Okay. Then they schedule me again. Now it's April. And these doctors tried to take it out. And I'm in pain this entire time. I would like to mention that I was not given anesthesia. I was not numbed. Nothing. The only time I was numbed was the very last time. And that's because I was sitting on that table screaming bloody murder. It's stuck. It is stuck in my... And I was supposed to get surgery for it to get it removed. Because now we've moved past them trying to remove it.
Oh my
I was supposed
God.
to get surgery.
I'm already even feeling traumatized on behalf of these ladies. Like getting surgery just to remove an IUD that was put in normally is crazy. I just want to ask a question. Is it normal that, healthcare providers don't take this type of thing seriously? Because this lady said that she wasn't taken seriously so many times in this video. She tried to remove it, but they were still turning her around. Like, isn't it something that if I walk into some healthcare, and say I want this taken out, isn't it something that should be done immediately? Or like, what's the process like? The amount of pain we can take is unbelievable. And of course, there are still people that have had good experiences with this. Let's not be quick to say that. And I have one video here for you guys to see this positive experience. But hey, what do I know? I haven't gotten it before. I don't know what to say. I don't know which one to advise you on. This is just me watching people's experiences with you. So let's get right into the video.
Guys, I'm driving home from getting my IUD swapped out, and I felt as though it is my responsibility to come on here and let you guys know that IUDs are fine, okay? There are so many horror stories on here about how getting an IUD is the worst pain you've ever experienced and that people were passing out and all this stuff, and I'm not like saying that those things did not happen, okay? Like if that's your experience, I'm so sorry that that happened to you, but I feel like people don't talk enough about the good experiences that they have. I got my first IUD when I was 19 years old. I didn't get the Kyleena because my insurance didn't cover it, so I got the Mirena, which is like the normal sized IUD, not the small one. It went fine, okay? 19 years old, went totally fine. It's crampy, but it's fine. Like I had period cramps that were way worse than that pain, okay? My IUD lasted me 5 years. It's all good. I just got it swapped out. I was freaking out thinking that I gaslit myself into thinking that that didn't hurt that bad when it really did because of all of the terrible stories that are on here. I was like, maybe I just like blacked that out of my memory. Like maybe it did hurt really bad, but I couldn't remember that it did. Anyway, I go there today. I'm so nervous. I'm like, it's gonna hurt so bad and blah, blah, blah. My IUD, the entire swap took less than 15 seconds. First one was out, New one was put in 15 seconds. It was, I'm not even kidding when I say this, 2 out of 10 pain. 2 out of 10 pain, okay? And it wasn't even pain, it felt like a cramp. It's fine. It's really, really fine. The sheer benefit of having the IUD far outweighs like the slight even if it was the most excruciating pain of my life, I would do it again because of the fact that I don't have to worry about I don't have to worry about taking a pill every day. I don't get a period. Like, it is the best thing ever. It is the best thing ever. I would marry my IUD if I could, okay? So I am here to tell you, as a 24-year-old girl who's now on her second IUD, it is fine. It's not bad at all. I recommend my IUD to everybody, and people just freak out about like the insertion and how painful it is. But again, guys, like, even if it was the worst pain of your life, it's 10 seconds. 10 seconds of pain. You can do anything for 10 seconds. I promise. You're gonna be okay. I wanted to share my good experience, okay? I wanted to share that it's possible for an IUD to be fine. To be completely fine. Okay? Okay. Thanks.
Well, there you have it. Different people with different experiences. But I mean, if you ask me, with all the pain, all the stories about pain that I just heard now, I'm still going to be scared to get it in because nobody would want to voluntarily subject herself to that kind of pain. But I mean, it's up to you, whichever one decides to go by. But I honestly just want to find out if you've had an IUD before. Let me know your experience in the comments because it's going to make me see things from a different line as well. That was so scary. That was really scary. These are the things that women go through just to prevent pregnancy. I saw people relieve their bad experiences just by saying their stories again. It's quite a lot to take in, I'm not gonna lie. And yes, beautiful people, I've come to the end of the video. I hope you all enjoyed it. If you did, don't forget to give the video a fat thumbs up. And if you are not subscribed to the channel, consider subscribing to the beautiful channel, okay? And also do not forget to click the bell just beside the subscribe button, so anytime I upload a video like this one, you definitely be the first to know, okay? All right, beautiful people, with that being said, I'll see you all in my next video. Bye.